today we are going to discuss about differential diagnosis of failure to thrive. Okay, so this is a short video listing the main causes system wise that you should take into account while assessing a child you are suspecting to have failure to thrive. Failure to thrive, either the child is not able to gain weight or decreasing the weight or has crossed the 2 centile lines, right? So starting with GI causes. The GI causes are pyloric stenosis, chronic cholecystitis, gastro or esophageal reflux disease, inflammatory bowel disease, chronic congenital diarrhea states like IPEX, eosinophilic esophagitis, malrotation, malabsorption syndrome, celiac disease, milk intolerance. That can be due to lactose intolerance or any protein intolerance, pancreatic insufficiency syndromes, pseudo obstruction. Coming on to the cardiac causes, cyanotic heart lesions and congestive heart failure can be one of the causes of failure to thrive. In the psychosocial and behavioral causes, there would be inadequate diet, either due to poverty or inappropriate preparation of the food, poor parenting skills, any child-parent interaction issues, food refusal or aversion or dysphagia, any parental mental health issues like depression, child abuse or child neglect. Neurological causes, if there is any oral motor dysfunction, then also the child will not be able to gain weight. These are seen in child with cerebral palsy, dysautonomia, brainstem lesions or Chiari malformation. Spasticity in the child, developmental delay, raised intracranial pressure and Danzig-Lux syndrome. The renal causes include UTI, renal tubular acidosis, renal failure. Endocrine causes, diabetes mellitus, adrenal insufficiency, hyperthyroidism, growth hormone deficiency. Genetic or metabolic or congenital causes, these include cystic fibrosis, sickle cell disease, inborn errors of metabolism, fetal alcohol syndrome, skeletal dysplasia, chromosomal disorders, vectoral or charge anomalies. Infections, any perinatal infection, occult or chronic infection, any parasitic infection, chronic infections like TB and HIV. In the miscellaneous causes, there would be autoimmune diseases, autoinflammatory diseases, recurrent fever syndrome, malignancy, primary immunodeficiency, and transplantation. So, here's a brief review of the differential diagnosis by system of failure to thrive.